Did you know that type 2 diabetes isn't just about high blood sugar? We want to introduce a term to you. It's called insulin resistance. Insulin resistance is both the front and back-end runner of diabetes. That's what you should be looking to reverse. But how? Good question. Simply put, insulin resistance is a situation where the cells in your muscles, fat, and liver don't respond to insulin. What is insulin? Insulin is a hormone produced by the pancreas in the body. What is it for? It helps guide glucose in the blood to the cells where they're used for energy or stored for future use. What happens when the cells get resistant to insulin? Glucose is trapped in the blood and cannot be metabolized. With time, this can lead to prediabetes and eventually diabetes. What causes insulin resistance? A lot of factors cause resistance to develop. However, the two most common ones are obesity, belly fat, lack of physical activity. Excess body fat causes chronic inflammation, which can lead to insulin resistance. Lack of physical activity over time can cause you to gain weight, which adds to the first point. If you're a type 2 diabetic patient, you should be looking to get your cells more sensitive to insulin. How do you do this? 1. Fasting. Going for a longer period without food increases your cell's sensitivity to insulin. It also allows insulin levels to drop naturally. You can start with the 16-8 method, where you fast for 16 hours and eat within an 8-hour window. The hack is to stay without food longer than you eat. 2. Regular exercise. Exercise is the single most important thing that increases insulin sensitivity. A single session of moderate intensity exercise increases glucose uptake by 40%. 3. Dietary changes. Cut down on foods with a high glycemic index. These foods can cause spikes in your blood sugar and add to insulin resistance. Go for low glycemic index foods like vegetables, beans and lentils, healthy fats, nuts, and seeds. 4. Lose excess weight. As little as a 5 to 10% drop in weight can significantly improve insulin sensitivity. You can achieve this with the 3 above listed points. 5. Don't stay up late. Get at least 7 to 8 hours of sleep every night. Consistent poor sleep can cause weight gain, which leads to insulin resistance. 6. Stop smoking and reduce alcohol intake. 7. Manage stress and stressful situations. What are the signs of insulin resistance? Increased hunger, even after eating. Weight gain around the abdomen. Persistent tiredness. Acanthosis. Nigricans. Dark patches of skin around the neck and armpits. Increased thirst and urination. Metabolic syndrome. High blood sugar, high blood pressure, and high cholesterol levels. Skin tags. Brain fog. PCOS in women. When you persistently have these symptoms, something is wrong and some changes should be made. The best thing you can do is to exercise and eat healthy foods with low glycemic index. Examples of these foods are broccoli, cabbage, and kale, tomatoes, carrots, and cucumbers, apples, berries, and grapes, whole grains like brown rice, beans, lentils, chicken peas, almonds, walnuts, chia seeds, eggs, and lean meats. Insulin resistance is a vicious cycle. The more you gain weight, the more resistant your cells are, and the more resistant they are, the more weight you gain. What we fail to realize is the key to good health lies with us. It just has to be activated. Pass this message to everyone you know, including your parents.